So as I was saying in the previous video, the distal radial ulnar joint is the point at which we have the lateral surface of the head of the ulna articulating with the ulnar notch on the distal end of the radius. Let's look closer at the ulna. The olecranon is the proximal end of the ulna, forming the point of your elbow, basically the funny bone. The trochlear notch is on the other side. It articulates with the trochlea of the humerus. That is the U. And you see that up here. And then the coronoid process forms the inferior lip of the trochlear notch. And it fits into the coronoid fossa of the humerus when you flex. The head of the ulna is distal. Usually you think of the head as being more proximal in bone, but in the forearm, the head is actually down here, and it's slender, rounded, distal end of the ulna. Then you have the ulnar styloid process, which are right here at the head on the opposite side of the radial styloid process. So those are those little projections to the side of your wrist. Okay, looking at the radius, you'll see we have also a radial head, and then we have, and this is the disc-shaped proximal end of the radius. So in this case, the radial head really is at the upper side compared to the ulna, and it articulates with the capitulum of the humerus. Then the neck of the radius is here. It extends from the radial head to the radial tuberosity, and then you have the radial tuberosity, which is the attachment site for the bicep brachii muscle. The ulnar notch is a site of articulation with the head of the ulna. And then the radial styloid process is a pointed projection on the distal end of the radius, and it helps stabilize the wrist joint. If we move down to the wrist, also called the carpus, we have 8 carpal bones. They're arranged in 2 rows. And I have not required you to memorize these, but I'll just go through them and name them. We have the scaphoid, the lunate, the triquetrum, the pisiform, the trapezium, the trapezoid, capitate, and the hamate. Looking at the metacarpal bones, these are the ones of the hand. They're identified by Roman numerals 1 through 5, starting at the lateral side. And so metacarpal 1 articulates with the trapezium and the thumb. And notice in this picture, this is the right wrist and hand. It's a posterior dorsal view. Looking at the phalanges, or the finger bones, they articulate with the metacarpals. There's 14 phalanges per hand. The pollex is the thumb. It has 2 phalanges, proximal and distal. All the other fingers have a distal, middle, and a proximal.
This is the hand. There are 8 small marble-shaped bones that make up the wrist. Those are called the carpals. The next 5 bones after the carpals are called the metacarpals. The metacarpals make up the palm of the hand area. And after the metacarpals are all the bones that make up the fingers and thumb. Those are called the phalanges. Each finger has 3 phalanges, a proximal, a middle, and a distal, except for the thumb, has just a proximal phalanx and a distal phalanx.
Okay, let's move down to the pelvic girdle. This is composed of 2 hip bones, also called coxal bones. Each hip bone is formed by the fusion of 3 bones, the ilium, the ischium, and the pubis. The pubic symphysis is a fibrocartilage pad connecting the right and the left pubic bones. And we'll go through some of these parts, although I haven't required you to know most of these. So we'll start with the iliac spine. We have a posterior, superior, posterior, inferior, anterior, superior, and interior, inferior spines. But you don't have to know all those. They are attachment sites for different muscles and ligaments. We have gluteal lines, both the anterior and posterior. These are attachment sites for your large hip muscles. You have the greater sciatic notch, which is a passageway of the sciatic nerve to your lower limb. You have the iliac crest, which is an important ridge for muscle attachment. The ischial spine, that projects superior to the lesser sciatic notch. This is a passageway of blood vessels, nerves, and small muscle. And the ischial tuberosity, which is a roughened projection. It bears your body weight when you are seated, so that's basically what you consider your butt bone. The acetabulum is a concave socket. This is where your femur articulates, and the smooth area inside of it is the lunate surface. The gap in the inferior portion of the bony rib is called the acetabular notch. The iliac fossa is a shallow depression that helps support your abdominal organs, and it provides an area for muscle attachment. And then you have the pectineal line. This is the ridge of the ends of the pubic tubercle. The arcuate line of the ilium is continuous with the pectineal line of the pubis. And then the auricular surface of the ilium, this articulates with the auricular surface of the sacrum. So this is where the sacrum joins at the sacroiliac joint. The iliac tuberosity, which is the upper part here, is a roughened area. Ligaments stabilize the sacroiliac joint at that point. The obturator foramen is this large opening here. It's closed by a sheet of collagen fibers. You have an inner and outer surface that provides a base for muscle attachment. And it's bounded by many parts: the ischial ramus, the inferior pubic ramus, and the superior pubic ramus.
The first thing that you should do when you're learning this bone is to determine whether you have a right or a left and to orient it the way it is in the body. To do that, you can find this rough surface on the wedge-shaped region. This rough surface faces front, and it's also toward the top of the bone. It's medial, and the socket for the leg is lateral. You can see pubis is coming front and center to form the pubic symphysis. And so you can see that this bone is a right. Once you know if you have a right or a left, make sure that you know the three regions. The big wedge-shaped region is called the ilium. And then taking a look at the hole in the bone, you'll see that on one side it's bulkier, that's the ischium. And on the other side of the hole, it's more fragile, that's pubis. Starting with the ilium, starting with that rough articular surface, this is where the sacrum articulates. Going across the top of the ilium, this is called the iliac crest. Ending at this point, called the anterior superior iliac spine. Moving the other direction from that sacral articulation point is the greater sciatic notch, the ischial spine. Right below the ischial spine where I'm holding the bone is a thick, bumpy area that's called the ischial tuberosity. The ischial tuberosity is right next to that hole called the obturator foramen. The obturator foramen is very close to, looking at the lateral surface of the bone, the acetabulum, the socket for the femur. Taking a look at pubis on the same surface as the acetabulum, we can see a projection called the pubic tubercle.
Okay, the pelvis contains bones of the axial skeleton, so the sacrum and coccyx, and the appendicular skeleton, the hip bone. And we have lots of ligaments that connect the sacrum with the iliac crest and the ischial tuberosity and the ischial spine and the arcuate line. Other ligaments connect the ilia to the lumbar vertebrae. We have the sacroiliac joint, which is the articulation between the sacrum and the adjacent ilium, shown there. Divisions of the pelvis include the true pelvis, which encloses the pelvic cavity. So we have the superior limit called the pelvic brim. So you see that listed here. Encloses the opening, and then the pelvic outlet. Opening bounded by the coccyx, the ischial tuberosities, the ischial spines, and the inferior pubic symphysis. And then the false pelvis consists of the area enclosed by the blade-like portions of the ilia superior to the pelvic brim. Okay, so the false pelvis goes from here to here. This is considered true on the inside. Let's move on and talk about some comparisons of the male and female skeletons. The female skull is 10% smaller and lighter and smoother. The female forehead is more vertical. The female sinuses, teeth, and mandible are smaller. You see this in the pictures below. Comparing the pelvis, the differences are due to variations in your body size and muscle mass. The female pelvis is smaller, lighter, has less prominent markings. And part of this is because of adaptations for childbearing. You have an enlarged pelvic outlet for the female, a broader pubic angle that's greater than 100 degrees, less curvature on the sacrum and coccyx, a wider, more circular pelvic inlet, and a broad, shallow pelvis. The ilia project farther laterally, but not as far superiorly.